Hi, my name is Jason Meyer, and my research proposal includes the topics of homework and anxiety and whether or not they're related. My interest in this topic comes from some personal experience, experiencing the difference in value placed upon homework in different schools that I've worked for. Additionally, I've observed that students tend to becoming increasingly more anxious and using more and more coping mechanisms to get through each day, such as nail biting and substance abuse. The research questions which my proposal addresses include: does the amount of homework assigned to 8th grade middle school students have an effect on their level of anxiety? And is the magnitude of the relationship between the amount of homework assigned and the level of anxiety in 8th grade middle school students significant? This research is important because the age group I've selected for this research is an area of need. There are vast amounts of research regarding high school students, but the middle school age has been vastly underrepresented in research, leaving a gap where more information is needed. Additionally, very little research has been done with the intent to show a relationship between these two variables that I've proposed. The proposed research that I have will determine the magnitude of the possible relationship between those two variables, homework and anxiety. In the literature review, there's been countless studies done arguing back and forth on whether or not to use homework ever since probably about the 1940s. I limited my literature review to studies done within the last 15 years or so, for the most part, just because most of that information was the most relevant. As you can see on the chart, Cooper, Robinson, and Patel, along with Bennett and Kalish in 2006, both determined that they were going to be anti-homework. Now, this didn't have anything to do with anxiety for either of these studies, but they did seem to believe that it was not healthy to have as much homework as students had been given at that time. The next year, in 2007, Freeman argued against that. He was a proponent of using homework as a source of continuity. He had therapists who would give homework to some of their patients, and they found that homework actually had a positive impact on some students that had anxiety disorders. The next year after that, in 2008, Dr. Leahy gave us a little thunder and brimstone, fire, and everything in his speech about the relationship between his comparison of high school age students who have this certain level of anxiety that used to only be present in psychiatric patients. He was comparing a current high school student to a psychiatric patient from about the 1950s. Ramdas and Zimmerman, they were very pro homework, seeing many benefits. Although they weren't concerned with anxiety, they saw things like self achievement, intrinsic motivation, things like that as benefits of using homework. The last two groups, Galloway, Connor, and Pope, and Leonard and Associates, um, were both very concerned with anxiety. Galloway, Connor, and Pope, they ultimately determined that they were anti-homework because of the impact on student anxiety that they were able to observe. They didn't draw any causal relationships, but they said that they thought there was a relationship between them. They weren't sure of the nature of that. Leonard never made a determination about pro or anti homework, but was very concerned with anxiety after students reported, less than 1% of the students reported in the survey in that study claimed that homework was not a stressor. The target population for my research is 8th grade middle school students in the United States. The type of sample that I will be using is called a random stratified cluster sampling. I'll use this type of sample in the hopes that the sample of U.S. middle schools that I obtain will be a representative sample of the overall population of U.S. middle schools and U.S. middle school 8th grade students. Participation in this experiment is voluntary for schools, but To be included in participation, the school must include the entire 8th grade class. The operational definitions include treatment groups, level of anxiety, and amount of homework. Treatment groups include three groups: Group 1, which is the control, Group 2, which has the first experimental treatment, and Group 3, which receives the second experimental treatment. The level of anxiety will be measured using the Beck Anxiety Inventory, which has 21 separate items for which a score can be developed between 0 and 63. Depending on the score, you'll receive a rating of either low anxiety, moderate anxiety, or potentially concerning levels of anxiety. The amount of homework will be determined by a direct administration survey given to all teachers and students involved. These surveys will use one close-ended question, which rate the amount of homework either assigned or received per week in hours using a Likert type scale. The other question will be an open-ended completion question. These surveys will be averaged to find the mean amount of homework received by students or assigned by teachers. The testing effect and test-retest reliability are concerns for the Beck Anxiety Inventory because a subject might learn something from the test the first time they take it, resulting in different behavior which might affect how that subject takes the test the next time. To reduce the issues of this type and confirm reliability, the Beck Anxiety Inventory has already been tested for internal consistency using Cronbach's alpha and subjected to test-retest conditions by Beck, Epstein, Brown, and Steer. In an attempt to also further establish the validity of the Beck Anxiety Inventory, it has been criterion validified by being moderately correlated with the revised Hamilton Anxiety Rating Scale and mildly correlated with the Hamilton Depression Rating Scale. Due to their nature, surveys are often assumed to be reliable anyway. However, the length of surveys used in this experiment are very short, and that can pose a threat to reliability. This issue has been addressed by assuring that the survey questions collect only quantitative data, not qualitative. Another concern is possible experimenter bias, which could threaten the validity of the surveys. This experimenter bias will be addressed by training the survey administrators to not influence the answers given by teachers or students on the survey. So let me walk you through the experimental process. First things first, we'll take the sample, which again is a random stratified cluster sampling. Then the schools that were assigned to the sample will be randomly assigned to treatment groups, either treatment 1, the control, treatment 2, the experimental group, or treatment 3, the second experimental group. Next will be the pretest and the surveys. So the surveys we've already talked about, having that open-ended question and the close-ended Likert style question. The pretest is going to be the Beck Anxiety Inventory. That'll give us a baseline. Next will be the experimental treatment. Going back to those treatment groups, you have Group 1, the control. There is no experimental treatment, we're just observing them in their normal state. The second group has the first experimental treatment, which is that they will receive half of the amount of homework based on the amount, the mean amount that their schools involved in that group would have normally given. The third group receives the second experimental treatment, which is no homework. Next, we'll do the post-test, which is another administration of the Beck Anxiety Inventory. Lastly, we'll go through and we'll do an analysis to try to draw conclusions based on the data that we've collected. Next, let's talk about the internal and external threats to the experiment's validity. Internal threats include selection bias, experimenter bias, and the testing effect. The selection bias is included and a concern because schools chosen for the sample may have different levels of achievement. The experimenter bias is a concern because different teachers will just naturally instruct differently, regardless of the treatment group they're a part of. Also, the experimenter bias goes along with the person who administers the surveys to staff and students. They may influence them in some way. The testing effect is the third concern. The problem with the testing effect is that subjects may realize they're being tested repeatedly and may not behave as they normally would once they are aware of that. The threats to external validity include selection bias and subject effects. Selection bias is a threat because schools were chosen at random, so some may perform at uniquely high or uniquely low levels within the test and may not be representative of the overall population. Hopefully, the stratified nature of the sample helps balance that out. Subject effects include things that have to do with the behavior of the subjects themselves. The fact that all subjects are human presents some difficulty because humans are unpredictable in nature and they may demonstrate varying behaviors such as the Hawthorne effect or the John Henry effect. The data collected in this experiment will address the research questions that you see on your screen. For research question number 1, I propose to use a one-way analysis of variance, also called ANOVA. The ANOVA will allow all 3 treatment groups to be compared by the F ratio, which uses the variance of the different group means to determine observed differences among groups. The F ratio will then need to be tested for significance to determine whether or not it will object the null hypothesis. For research question number 2, I propose to use a Pearson product moment correlation coefficient, commonly known as Pearson's R, with a significance set at plus or minus 0.4. This should determine the magnitude of the relationship between homework and anxiety. I also propose to use proactive ex post facto research to determine whether or not that strength is one-sided or whether or not there is maybe another third common variable that connects anxiety and homework.